All right, let's do some med math. I'm going to skip this just because this is basically a review from whatever you previously learned in first semester. So let's go ahead and go over IV therapy med math. So first, let's go over the question. The primary care provider, PCP, orders 1,000 ml of normal saline to be given over 6 hours. Pay attention to the question. It's asking what is the hourly rate, and using the set factor, 15 drops per ml, how many drops per minute will the nurse or will the normal saline infuse? So looking at this, it seems like there's two questions. You want the hourly rate, and at the same time, you also want drops per minute. So first, let's calculate for the hourly rate. That's actually pretty straightforward. And so how do we start? Well, we always start with the order. So make sure you're starting consistently. If you have your own way of calculating things, you can go ahead and do that. That being said, make sure that you're consistent to avoid any sort of confusion, because that's usually when mistakes happen. So the way I usually do it is I get the order, right? And to get the hourly rate, I take the 1,000. So 1,000 ml. It says over, so underneath there, 6 hours. This is straightforward. This is what I'm going to set on that pump, right? 1,000 divided by 6, it's 1, 6, 6, and 6, 6, 6, 6, and all that stuff, right? But knowing how the pump works, we need to round this to the nearest tenth. So your answer will be 166.7 ml per hour. So that's the answer to the first part of the question, right? That's the hourly rate. Now, if it asks you for drops per minute, and sometimes it may not be as straightforward, the question may tell you that you don't have an IV pump and you have to infuse it to gravity, then that's what they mean. You need to find the drops per minute. So let's calculate for the second part, right? So we start with 1,000 ml. I'm sorry about that. 1,000 ml over 6 hours. And this is when we're going to use the drop factor. So here, right, we're going to put the drops per ml. ml goes underneath. So this is 1 ml. We're getting it from here. And then 15 goes on top, right? So that we can cancel this 2 because we wanted the drops, right? Next, we still have hour here, but the answer should be drops per minute. So how do we convert hour to minute? So that's what we're going to use right now. For each hour, for 1 hour, there's 60 minutes. And so this will allow us to cancel this part right here. And then we just multiply across 1,000 times 15. We have 15,000 over 6 times 60, 360. And then our answer is actually 41.66 and so on. For drop factor, so for drops per minute, it needs to be in whole number. So we round it to the nearest whole number. Our answer would be 42 drops per minute. So that would be your answer to this, right? Because we canceled everything else, then we have drops per minute left. All right, let's try to answer the next one. I'm just going to erase this because I really don't have a lot of space on my screen. There we go. Okay. Alrighty, next, PCP orders patient to receive 1 unit of FFP over 2 hours. The unit of FFP contains 450. So we have to administer that 450 ml over 2 hours. The question is, what is the hourly rate? So that's the first question. And then the second question is, using the set factor of 10 drops per ml, how many drops per minute? So again, there are 2 questions, so similar to the first one. First, we need to find the hourly rate, and next is how the rate if we're basically infusing it to gravity, which is drops per minute. So let's start with the hourly rate. Pretty straightforward. We get 450, so that's the amount of fluid in the bag. We want to administer it over 2 hours, right? So you divide it to 2 hours. Then you get 225 ml per hour. Done, right? That's your answer for the first part. Okay. Now, the second part. Go back and get 450 ml again over 2 hours. And again, we're trying to find 4 drops per minute. Using the provided drop factor, which is 10 drops per ml, right? ml goes here, so 1 ml, right? So we can cancel this. And then the drop is on top, so drop. Okay, and then again, this is in hours, so we need to convert it into minutes. So how do we do that? Per hour, 1 hour has 60 minutes. So now we can cancel this and this, right? So we're going to be left with drops per minute. And then multiply across. 450 times 10, 4,500 over 2 times 60, right? Then it's 120. 4,500 divided by 120, that would be 37.5 drops per minute, right? But again, this needs to be in whole number, and so we have to round up. So this is actually 38 drops per minute. All right. Next question. So the key to this is really slow down and analyze what is it that the question is asking you, right? What do you need to calculate for? Because sometimes it can be tricky. Sometimes it's pretty straightforward. It will ask you what is the hourly rate, but sometimes it will tell you to give the infusion rate using an IV pump. So if it's using an IV pump, it should be the hourly rate. If it's to gravity, then it would be the drops per minute. Anyway, let's go to the third problem. So you have 1,000 ml of LR, and it needs to be infused over 12 hours. Using the set factor of 60 drops per ml, how many drops per minute will you infuse? All right, so let's go back. Okay, so for this one, there's only one question. It's not asking you the hourly rate. It just needs the drops per minute. So let's go ahead and calculate for that. 1,000 ml of LR, right? And it says that it's going to be given over 12 hours. Then you use the drop factor, which is 60 drops per ml. Again, ml goes to the bottom to cancel that ml on top, right? So 1 ml for 60 drops, right? Then we have to convert the hour to minute. So we have in every hour, we have 60 minutes, right? So that's our conversion rate. Okay, and then again, multiply across. So when you multiply across 60,000 over 12 times 60, that would be 720. And your answer is 83333 and so on. Again, we need to round it to the nearest whole number. So it's going to be, because this is less than 5, we're going to round it to 83 drops per minute. All right. So that's that. Now let's move on to the next page. So this is going to be slide 43. All right. On this page, the first problem, it says the MD orders 1,000 ml of LR to be given over 4 hours. What is the hourly rate? And then it says, using the set factor 15 drops per ml, how many drops per minute will the LR infuse? See here. So let's start with the hourly rate. It says that we have 1,000 ml over 4 hours. Straightforward, right? 1,000 divided by 4. Then you have 250 mLs an hour. Okay? And then, now we're going to calculate for the drop factor. Drop factor, let's go start all over again. 1,000 ml over 4 hours times per each ml, there's 15 drops. Each ml, there's 15 drops. And then you multiply it by for 1 hour, there's 60. Okay. Let me get my calculator. I actually calculated everything else in advance except for this one. So, all right. So we have 1,000 times 15. So that's 15,000 over 4 times 60, 240. So 15,000 divided by 240 equals to 62.5, right? But then again, this is drops per minute. It should be in whole numbers, so we're gonna round it up because this is 5, right? So it's gonna be 63 drops per minute for this one. Okay, now we're gonna go over the next problem. So the next problem, actually, let me erase this. That way it's not confusing. If you need to pause the video, please pause the video so you can follow along. But I just need the space so I can calculate for the other things. Now, the next problem, it says that the MD orders antibiotic 2 gram in 100 ml to be given over 30 minutes. So how would you calculate for the hourly rate? Again, always start with the order. I think that's always easier. So disregard this part, right? Because now we're trying to just calculate the rate. So we're just more focused on the how much in that ml, right? In that bag. So we start with 100 ml, and we said that we were going to infuse it over 30 minutes. But then remember, the question says hourly rate, so that's what we want. So we need to also convert, right, the minute to hour. So it gives us a clue to convert that. So in 1 hour, there's 60 minutes. Now we multiply across, right? So you have 6,000 over 30. 6,000 over 30, that would be, I believe it's 200. Okay, that would be 200 ml an hour. So that would be the answer to this question. And again, there's no additional question. The only question that it asks you is the hourly rate, which is also equivalent to the IV rate on an IV pump. Whenever it asks you this, right, it's equivalent to infusing to gravity, or infusing without pump, right? Saying no pump, or to gravity. So just remember that those are the clues so that you can figure out what is it that you're calculating for. All right, the last problem here is going to be a little tricky. This will remind you a little bit of the pediatric calculations. So you have vancomycin 1,750 IV piggyback every 6 hours has been ordered for a 70-year-old client weighing 70 kilograms. Pay attention to the weight. And then it says that the safe dose is 40 milligrams per kilogram per day. Now we're just trying to figure out, is this a safe dose, right? Remember the pediatric calculation section? So it's basically the same thing, right? Or very similar. Okay, so first, we have to figure out if we have to calculate for the weight. But looking at this, we need kilograms, right? We already have kilograms, so we don't have to worry about that. So just keep in mind that you have 70 kilograms as the weight. Next, right? Looking at this, your safe range, you're going to use that to calculate for the safe dose per day. So I'm going to get that 40 milligrams times the weight, which is 70, which is equal to 2,800 milligrams per day. So in a day, this is the safe amount of medication that I can give. All right, the question is this safe for the patient? But if you're looking at the order, it tells you how much you're giving every 6 hours. So how do I know how much will I give in a 24-hour period? Well, this is pretty straightforward. Think about it. There's 24 hours in a day, right? So 24 hours in a day, how many 6 hours do you need to get 24 hours? So it would be 4. So what you're going to do if you're giving it every 6 hours, then you're going to end up giving it 4 times. So to calculate for how much you would have end up giving if you give it every 6 hours, you take 750 times 4. Then you have 7,000 milligrams per day. So if you gave this every 6 hours, which is 4 times a day, you're going to end up with 7,000 milligrams per day. The question is this safe, right? If we're saying that this is safe, is this within this value, right? Is this above this value? It is above this value. So meaning this is not safe. So no, it's not safe. Anyway, so that's it for now. We're going to go and review some more calculations tomorrow during IV therapy. I hope that this helps. Please let me know if you have any questions or concerns. And next week, we can go over some med math problems with IV medications as well, just to have a little bit of a review. See you tomorrow. Bye-bye.